Now, a lot of my patients don't come in initially to see me for that. They come in for another reason, and then just in passing, or when I ask them about their cycles, they're like, oh yeah, they're irregular, or they're really painful, or I'm miserable 2 weeks out of the month. And it's almost like an aside, like a lot of people just think that's normal. And that's the way they like to live. And I'm like, whoa, back up. Yeah. That does not have to be like your reality.
Exactly. Hi, I'm Dr. Angila Yeagley, here today with my friend and colleague, Dr. Anastasia Jones.
Hey there.
Welcome to Sage Health TV, a weekly show where we review lots of health topics on being the best you. So subscribe, like, and share. Today, we review female hormone balance. So this is an amazing topic on a lot of different areas for women. And so this is going to cover, today we're going to talk about PMS, which is premenstrual syndrome, irregular cycles, painful periods, and heavy periods, and
or amenorrhea, which is the absence of your cycles, or or
which
missing your period.
Yeah, and all concerning for many different reasons. Whether it's feeling and you're in pain, or say with amenorrhea, a lot of women, that's concerning. Leading to a concern about infertility. So we're going to get into how do you identify like the hormones that are affecting you, the balance of the hormones that are affecting you, and then what do you do to balance them, in a natural, healthy way.
So this is a topic that affects so many women, and I can't tell you in the 15 years that I've been working 15 to 20 years I've been working in the field of women's health in various areas. I would say maybe 80 to 90% of women are affected by some type of hormone imbalance at some point.
At some point, right.
Now, a lot of my patients don't come in initially to see me for that. They come in for another reason, and then just in passing, or when I ask them about their cycles, they're like, oh yeah, they're irregular, or they're really painful, or I'm miserable 2 weeks out of the month. And it's almost like an aside, like a lot of people just think that's normal. And that's the way they like to live. And I'm like, whoa, back up. That does not have to be like your reality.
Exactly. And you don't have to be, many times in the traditional medical world, the option is a birth control pill. And just let's just try birth control pill. And there are so many other options beyond that.
And we can definitely get into that more. And I definitely do not use oral contraceptives to treat symptoms. Now, if people want it for contraception, that's another topic, and we'll get into it. But there are so many approaches to regulating a woman's period, and also just getting rid of those terrible monthly effects that really, once again, don't need to have.
So what are the symptoms? Like when we come back to, especially let's maybe get a little bit into PMS. So we're talking about bloating, mood imbalance, and that can be anxiety or depression.
Irritability
is a huge one. Yeah. Cravings, low libido, other digestive complaints.
I see a lot of GI symptoms where people are constipated or have diarrhea, sleep changes, and migraines, which we touched on in a past episode, can also be a big one. So there's a huge list. And once again, they are all not necessarily attributed to hormone imbalance, but if people are seeing them come in a cyclic way, then that's a really good place to start looking at to correct some of those problems.
And especially, many times we have to look at a lot of different areas, in correction, especially if something is more severe. So, we were talking about that like 8 to 10% of women have actually pretty severe symptoms, and you really need to, we're working on the digestive system and the liver, and we're going to get into why we want to do that with hormones.
The term for more serious PMS is PMDD, and that affects about 8 to 10% of women, it's thought, and that is where there's extreme mood swings, and also just more extreme, often more extreme pain, sleep problems. Usually the origin of the issue is the same, but it's just manifesting much more prevalently. So
yeah, and there can be some other, we've talked about this also in another episode, getting back into different genetic variations that actually predispose someone to experience pain a little more significantly than someone else, or have more difficulty with the detoxification of the hormones that they're exposed to. So that's another area we like to look at.
Sorry to interrupt. So talking about hormone balance, really what we're looking at, although there's, several hormones that play into it, kind of the two biggies we talk about are estrogen and progesterone. And those are hormones that are very, critical to having a regular cycle.
Right.
And they ebb and flow according to the phase we are in our cycle, whether we're in follicular, luteal, and those are the ones that often, we see, whether it's high estrogen, which is really, really common, low progesterone, which is really, really common, or a combination of both, where it's estrogen dominance, meaning there's just too much estrogen, whether there's normal progesterone or low progesterone. Right. And that, can lead to a host of symptoms that are pretty easy to identify on symptom patterns, like when people walk in. And what I'll see a lot with high estrogen is, and not always, there's always variations, but I'll see women who definitely have challenges with weight gain. And a lot of times that is going to be in the hips, the thighs, or the breasts, like just, a hard time losing, or they're gaining weight in those areas. Tend to have heavier periods where they are bleeding a lot. That may lead to anemia. Also common to see shorter cycles where they don't go as long. They don't go that full 28 to 31 days between cycles. And
many times more painful, more cramping. And then also, because again, even if that, as Dr. Anastasia mentioned, that if the progesterone looks normal, but you have the ratio is off and that estrogen is really high, mood. Yeah. Progesterone balance is so crucial, and then estrogen regulation, so important for mood support. Absolute. And usually that's where we see, when we're correcting those ratios, we start really seeing some amazing changes. So the way that we go, initial testing that we might do are looking at that basic. Usually I like to do a total estrogen as well, because again, as Dr. Anastasia mentioned, we have many forms of estrogen. It's not just our main form of estrogen, estradiol. And then estradiol and progesterone, those can be run through your normal lab, normal insurance. Sometimes when we get a little deeper, we're fine-tuning things related to, maybe fertility, or somebody we need to dig a little deeper. There are panels where you can go and see how all of your hormones are and all their metabolites. And those are pretty interesting.
Those are great. And I mean, my preference is to do salivary, which can look at, what are considered the free hormones and
the active.
But those are also very expensive and often not covered by insurance. And we can get great information from the symptom presentation, that pattern, clinical presentation, and then blood work as well.
Right. Exactly. So let's say, we get these back, someone's having these symptoms, of PMS and bloating and mood. And we're seeing a typical picture. It's just so common, that high estrogen, and low progesterone. So let's get into, we're going to talk about how do we start balancing these things? So maybe beginning with estrogen, there are particular, if the estrogen is high, there are particular herbs that have a progesterone-like effect, as well as other nutrients that can counter their kind of weak estrogens that take the space of where your normal, regular, very strong estrogens like to be on your receptors, right?
Yep, that's one way. Another really important thing to look at with elevated estrogen is, there's two really important things in my book that have nothing to do with necessarily raising either of the other hormones. It's really looking at, one, where are we getting exposed to things in our environment that are called xenoestrogens? And what that means is those are chemicals or compounds that get into our body and they look like estrogens. They're very chemically similar, and they bind very strongly to our estrogen receptors. Those are things like plastics, phthalates, parabens, a lot of pesticides. And
that's like your BPA that you're hearing about.
Pesticides, and herbicides. Those molecularly are very similar to estrogen. So we're getting all of these things in through our environment. And as these continue to rise in the environment, they are affecting both actually men and women very, very strongly.
Very strongly.
Yeah.
And not to mention, we were talking about earlier, off video of like all the hormones in meat still, you know, and why that's so important, especially for everyone really, but especially if you have hormone imbalance, that you need to be looking for pasture raised, you know, organically
meat and dairy.
Meat
there's
and
just
dairy.
a lot there. And then hopefully organic produce helps. Not drinking out of plastic, being aware of just the body products you use. There's so many factors that we can't control everything, but that we can start to address.
You just start reducing, right? Yeah. So with that, then the other crucial part is balance, like looking at liver. So liver is one of our major organs of detoxification, and you know we think of liver when we're like, oh, we're going to do a cleanse, which is amazing, but liver is intimately involved in regulating your hormones, along with the gut, right? So we have to support the liver's ability to what we call like basically conjugate and get those extra hormones out of the system.
And that's it's really important because like she mentions, that our estrogen gets produced in the body, but we've also got the other circulating xenoestrogens, and we can get really overwhelmed if our detoxification systems are not working well. The estrogens have to get what's called conjugated, and then they actually also have to then be, once they're conjugated, they usually get excreted, and that means that it's really important also for women to have really regular bowel movements. I find that a lot of my women or patients who have high estrogen are constipated, so I always ask people about that. And there's all these things that don't seem connected, but are really important. And then some of the liver things, just thinking of liver foods that are so good, like all the cruciferous vegetables that are high in
that's like your broccoli and your cauliflower and then the other root vegetables.
Those are amazing. And then things like milk thistle is great, burdock root, anything that's just going to stimulate liver cleansing is really, really important. Keeping alcohol intake really low is important, so your liver's not busy processing that.
Right. And any other things like, you know, again, anything with lots of chemicals or, you know, any processed food, things like that. And sweating and exercise, so many other things that help liver. And then also gut. So you want to improve the gut's ability to be having healthy daily bowel movements. Many times probiotics can be helpful.
And there's specific strains. We won't get into the name of it, but there's some that they've shown that are really important in the microbiome for hormone balance.
Right. So. And again, because the gut is responsible for taking those hormones and the ones that your liver is trying to get rid of and pushing them out of your body, as opposed to if they sit in the gut too long, or if you don't have an efficient process of binding them, like they're going to reabsorb in your intestine, and then all of a sudden your levels are back, you know, where you don't want them to be, right? And then coming into progesterone balance. So we do all of those things. Progesterone is an amazing hormone for, I would say probably, it does a lot of things, but balancing mood is related to hormone imbalance is incredible. And so things we use to balance progesterone are going to be, there's certain herbs, like chaste tree.
I'm a huge fan of that. It works fairly, you know, it's not going to work like overnight, but I have had amazing results using chaste tree berry, also called Vitex. With women, what it does is it actually stimulates LH, which is luteinizing hormone, which is responsible for telling the ovaries to make progesterone. And I have seen people really start to head in that right direction with raising progesterone and correcting irregular cycles in, you know, as little as 2 to 3 cycles. Not always that fast.
I would say less sometimes. Depending. If you're working on other things too.
And using that in combination with things like that herb's amazing. There's another one called Shatavari, which is an Ayurvedic herb, which is just awesome for that balance.
Right. Red clover.
Red clover's great for
I love Dong Quai, depending on the type of, you know, presentation someone has. And then there are many more, actually, that we use. One of the others, sometimes it depends on the woman, but if we need to be a little stronger, sometimes I'll reach for bioidentical progesterone, and really amazing studies on actually protection of the breasts and ovaries and uterus related to, risk of cancer, because it is anti-estrogenic, which is usually a driver. And then again, just that amazing sleep,
and just,
mood.
And just to back up, when we're talking about progesterone supplementation with bioidentical progesterone, that is not progestin. That is not what is in oral contraceptives. A lot of times people say, well, I'm taking
I've got progesterone.
I've got progesterone. And progestin is very, very different. It's given in microdoses to essentially trick the body.
Yeah.
And it will bind to receptors, but it doesn't function systemically the way progesterone does. And it also has risk factors that bioidentical progesterone does not have. And so often those get overlapped, and people are like, oh, I heard that progesterone does this, and this. And I'm like, no, that's progestin. And so
very important point.
Clear. And in fact, progestin, it's teeny amounts of synthetic progesterone can actually stop your body from making its own progesterone. It's kind of saying, hey, we've got some here, we don't need it. And so people will be super low progesterone and not getting all of those benefits they need because their body thinks it has it, but it doesn't. So, and that can lead to a whole other, feed into this whole pattern.
So that's another, thing that we have to, we take into account, what other hormones is someone on, and, or have they been on, and some of that stuff can get stored, and we have to help the body shift that balance. Right. Really looking at, hormone balance, again, liver, gut, balancing those hormones. And I would say most times with this approach, like as you mentioned, I see usually many times within a month, we see where it's going in the right direction that we want it to go. Might not be completely gone, but
it takes a little time, and especially if it's been going on a while. There's a couple of other really important nutrients. I always have to mention magnesium. That one is really, really critical. It helps the liver to detoxify estrogens. And vitamin D is really important. It actually upregulates progesterone receptors. So using, whether we're increasing people's progesterone naturally or using a bioidentical progesterone, they're going to respond to it so much better if they have adequate D. And then B6, which is really, really important for the formation and development of the corpus luteum, which is what happens during ovulation. It's a whole other topic, but the B6 is really important, and so is methylfolate and some of these other.
And that's getting back to the genetic markers, and we've talked about MTHFR, coming back to that need for folate as well.
So for some people, it can be really simple. I've had patients come in, they're maybe young women, they've been really athletic, they don't have periods very often, and they're kind of heading into that age where they're like, okay, I want to, get regular periods. I'm thinking about starting a family at some point, but I only have a period twice a year. Those can be sometimes pretty simple. It's like we get them on some Vitex. I've had patients like this where I do just herbal formulas, a couple of nutrients, maybe look at if they're underweight or, other cases maybe overweight and a few things. And people can regulate fairly quickly.
Yeah, they can. Absolutely.
With some simple stuff.
So thank you so much for joining us today. Love it again. Like, subscribe, and follow us.
We don't want you to miss an episode, so subscribe to our channel.
That's right. And we will see you next time.
Thanks for joining us.
Thanks for joining us.